This sponsor spotlight episode of the Healthcare Security Cast is brought to you exclusively by Genatech. Genatech, delivering security strategies for healthcare. Visit genatech.com for more information. That's GENETEC.com.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast Sponsor Spotlight. Today we're joined by Arcuri from Genatech. He'll be discussing some of the ways that Genatech is leveraging their technologies to help healthcare facilities run more efficiently and effectively, as well as how they're helping hospitals during this COVID-19 pandemic. Hope you enjoy. Welcome to the Healthcare Security Cast. Today is our sponsor spotlight, and we're joined by Arcuri from Genatech. Derek, thanks for joining us today.
Glad to be here, Brian.
And for those of us who may not be familiar with Genatech, could you give us a little bit of background about yourself and the company as well?
Yeah, sure. So I'm Derek Arcuri, head of the industry marketing team at Genatech, and I support the dedicated healthcare practice at Genatech. And so that's a group of healthcare experts that are spending their professional time interacting with the healthcare industry and effectively co-developing solutions to help healthcare institutions. So Genatech is a security software manufacturer and services company. We build connected and resilient systems that ultimately help healthcare institutions keep the bad guys out, keep security teams really adding value to not just from protecting people and assets, but ultimately contributing towards other departments.
Excellent. And what are some of the technologies that you're seeing being leveraged in healthcare facilities right now?
So there's quite a wide array of security technologies. So by default, I think access control and identity and access management is obviously a need within the healthcare space. So that's something that Genatech offers. Video management, intrusion, but even incident management. So the concept of when an incident occurs, guiding the operator through codified standard operating procedures to make sure that they're compliant and that they're not deviating from their incident response guide. So that's a category of technology that we're seeing increasing adoption within the healthcare space. One that I'd like to explore a little bit more is real-time location services. So that's a sort of a booming category that we're seeing with a lot of vendors. That's not something that Genatech manufactures, but something that we integrate with and provides, integrating real-time location services with the physical security system enables a lot of use cases that I'd like to explore later on the podcast. And also digital evidence management. So the concept of sharing evidence with internal or external stakeholders, whether it's law enforcement or whether it's with different departments in the hospital or healthcare institution. It's a lot better than downloading evidence, burning it on a DVD or putting it on a USB stick to then share it with other external collaborators. So there's quite a bit there in terms of security technology adoption. So I'd hope to cover at least a little bit and maybe shed some light on as to what other healthcare end users that we're seeing and how they're actually using that security technology in their day-to-day.
Excellent. Well, actually, yeah, let's go right there then. So as you've alluded to, some of this technology is making a difference on the day-to-day operations and just allowing departments to run more smoothly and efficiently. Can you explain how that's happening? And if you could just go into detail on that a little bit as well.
Yeah, so I think that if we stay on real-time location services or RTLS, we're seeing that within healthcare that being used to be notified whenever there's a wandering patient. So it might be in the certain areas of the hospital that have patients that if they were to wander, they could either injure themselves or injure other people. And so you don't want to lock them in their room, but you just want to be notified if ever they've deviated or have left their room or left a location that they shouldn't be in. And by putting an active tag on every patient, you'd be able to know that where all of these individuals are in real time and be notified if ever they hit a geofence. So that's a type of that's the use case, the general use case that we see with RTLS, and I'd like to come back to that later on. But I also want to talk about thermal cameras that could be used to detect if, say, a patient has fallen out of a bed. Installing a thermal camera in the room is an excellent way to sort of get the visual context of what's going on in the room, but without infringing on privacy. We wouldn't get any identifiable information because you're measuring temperature. So you see sort of those silhouettes within your field of view without actually seeing that it's yourself, Brian, or myself in that bed. And whenever that target temperature goes below a threshold, instead of reading our body temperature, then reads the temperature of the bed, and eventually that'll cool down. So that could be an accurate way to detect whether a patient has fallen out of the bed, as opposed to relying on a push button that a patient would have to press to signify that they're in distress. We're also seeing SIP-based communication or voice over IP communication being used from whether it's nurses that want to communicate with patients. So that's an application that we're seeing of security technology. You can tap into these cameras that are also audio devices. Now there's specific versions of those cameras that have built-in audio and video, so they can be used as an intercom that shows pretty much the same concepts that we're using today, Brian, for the podcast, where I could see your face and I could also hear your audio. So that's an application that we're seeing more and more of. Another is around just general access control reports. So getting an idea whether they're patients using real-time location services where patients are, or whether it's staff that are using their credential to access certain doorways or certain areas within the healthcare facility, or whether it's a license plate being used to access different parts of the parking lot. All of these reports can be used in order to help contribute or help at least understand the utilization of the healthcare environment. And that could be used to help planning, construction, engineering teams plan the future hospital, so that at least they have some metrics that they could base their growth plans off of. But it could also it could be a great way to measure occupancy. So if you'd want to ensure that there's building codes are being respected, that they're not an overwhelming amount of individuals occupying a certain space, well, that's a great way where the camera can start counting how many people there are in that space, and then maybe lock the door down to stop anyone else from entering until the occupancy reduces, or maybe send out a notification to certain staff so that they could go out and ensure that there aren't too many people congregating in that area, to either respect building codes for fire safety reasons, or if it's for whatever reasons, especially these days, we want to ensure that there aren't too many people congregating. And I did promise, Brian, to get back to the real-time location services. I think that there's a growing concern around workplace health and safety, and there's quite a bit of violence, often a lot of violence that gets underreported within the healthcare space. And so an RTLS or real-time location services can also be a great way to equip nurses or staff with a means to signal that they're in distress or that they're being violated or abused. And that'll help empower the security operator to see where exactly that individual is, pop up the closest camera, verify that they're in fact in distress, and then initiate their response as quickly as possible.
All right. And actually, yeah, you did jump on the next point I wanted to get into a little bit, and that is indeed workplace violence. Obviously, workplace violence has long been an issue in the healthcare environment. And you did mention some of the things that Genatech's doing. What other ways is Genatech helping tackle this challenge?
Well, so there's, I think, there's the real-time location services that I want to uncover, but there's also some statistics that I wanted to, I've been doing a bit of research, and what I found is that workplace violence incidents requiring time off in order to recuperate in the healthcare industry is 4 times greater than in the private sector. So that's a statistics, it's a US-based statistic. 2 out of 3 of incidents against healthcare employees are caused by patients, their families, or visitors, and then 1/3 are caused by other employees. So those are American statistics. I'm Canadian based. I always like to do a bit of research in my homeland. And according to the Canada House of Commons, 61% of nurses have experienced abuse, harassment, or assault within 1 year of working within the healthcare environment. So that's quite a bit. And it's also estimated that 53% of incidents are not reported. There was a case actually in New Brunswick in province on the east part of Canada where there was a nurse named Norma Melanson who was a victim of an attack for a whopping 11 minutes. She indicated that if she had the ability to buzz security or to let them know that she was under distress, that would have obviously shortened the beating significantly instead of it eventually getting noticed by another employee. So there, I think it's without quite obvious that the healthcare sector is subject to this type of violence more than the private sector. And so what we're seeing and how security technology can help equip the staff members with the means and to signal that they're under distress is their tag that they use to access a card, that actual RFID active tag has a little button on it. They hit a button to say I'm under distress, and that communicates to the gateway node, which is part of the security infrastructure that would then signal to the security operator where exactly is that individual. And there are these beacons scattered throughout the hospital. They're either plugged into the wall outlets or in the ceilings, and they would then triangulate the location of that victim. And so the security operator in the command and control room would see, okay, well, it looks like Brian has signaled that he's under distress. I know exactly where he is right now and at the point where he hit that button. So I'm going to bring up the camera to see, what's actually going on there. So that's the primary use case to ensure that we're at least reacting to staff that have signaled distress. But it's also great to sort of know whenever disoriented patients start to wander, especially those with a history of violence. So that could be a little bit more proactive. If we see that I have a history of violence and I've left my room and I've woken up in a panic, then I want to know right away as soon as I left my room. And maybe it's time to dispatch the guard so that if things were to escalate, at least they're close by. There's also something that we're seeing a little bit more and more of is using the closest intercom for voice calm down capabilities. So, in that example where I wake up in a panic, I could have maybe my spouse that the MP3 recording of my spouse would play as soon as I've left that area. That might say, "Hey, Derek, it's okay. Go back to your room. Everything's fine. No need to get panicked or startled." And so that's something that can be programmed in the security platform that could use the intercom devices that are already scattered throughout the hospital environment, or even the cameras that are scattered throughout the hospital environment to play those MP3 sound bites in order to calm down that individual so that things don't get escalated.
Yeah, that could definitely be a great de-escalation tool. I could see that being applied in a number of applications. Great. Right now, what are some of the ways that Genatech is supporting healthcare facilities during this COVID crisis?
Yeah, that's a great question. And before I respond to that, I just want to recognize that a lot of what Genatech has done is actually co-development efforts with the healthcare facilities. So I talked about our healthcare practice at Genatech. One of their jobs is to really work with healthcare institutions, and nobody knows that environment better than the actual healthcare institutions themselves. And so there's actually a number of new functionalities that we've built since the pandemic, especially as the healthcare sector is working during this crisis, the current pandemic. So one of them is using the security platform to do patient rounds, to check up on patients, just for routine checkups that traditionally would be physical, meaning that a nurse might do a checkup on their 4 patients, and they would have to burn through PPE every time they'd visit a patient with COVID-19. As soon as they'd finish asking those questions, they'd then have to take off their PPE and then put on a fresh gown, a fresh visor, fresh gloves. And that would burn their PPE a lot quicker than if they were to find a digital means to actually check up on their patients. And so a lot of healthcare institutions said, well, we have the cameras that have audio capabilities. What if we just gave the nurses access to the security platform? They have their 4 patients where they see the cameras at all time. They just right click and initiate a conversation. And in that way, the nurse would ask their basic questions, making sure that the patient is fine without actually burning through PPE. So that's one solution that is already available in pretty much every security platform. We've just helped make the client applications accessible to the nurses, and so we built a package that really addresses that specific use case. We've also been challenged to convert a drug diversion solution into a PPE diversion solution. So now more than ever, protective equipment is commoditized and it's in demand, just like any day, typical day where narcotics are usually in demand. And so what we've built, and we've actually, inspired by the customers and inspired by how we actually order food at our Genatech headquarters, we've built this honor-based dispensary system where you'd present your badge to a kiosk and say, I'd like to request 30 masks, or maybe it's 1 gown and a visor. And then right away, my credential that I use to start that session with that point of sale system would now my card can be used to actually access the cabinet or the door for the inventory room. And I could right away access the inventory and take as much or as little as I want, but it's really based on the honor system. And the reason why this is really scratching the healthcare industry where they particularly itch is because this PPE is not typically one of those pieces of equipment that required or that traditionally was worthwhile tagging, right? No sense spending maybe 30, 40 bucks on an active tag for things that cost pennies to make. And so this was something that typically never really got much security. We can't really know the real-time location of every mask or gown, right? And so they're challenging us to think of a way, how could we actually build an inventory management system inspired by the drug diversion use case, where you're keeping narcotics in certain cabinets, and based on requests, if you need access to certain medication because of patient XYZ, or Z, you'd be able to submit that request. Upon approval, you'd gain access with your credential, you'd access that cabinet, and maybe there's a 2-person rule that's enforced as well. There's yourself and the inventory manager that has to both present their credential, and of course, everything is being recorded. And so ultimately, what that helps, it helps the security department from a forensic analysis standpoint, gaining key metrics on, okay, show me every time that that door was opened, so that I could start doing some analytics. I've noticed that Brian accesses that door significantly more often or significantly less often than all of his peers. Why is that? Let me pull up the cameras and see, is he walking out with boxes of PPE? And so it really just helps from a forensic standpoint ensure that that you're speeding up your ability to actually uncover some potential theft trends. And it also acts as a deterrent as well, knowing that you're being recorded, knowing that every time you swipe your badge, your identity is associated with you walking into that control room or that inventory room to access that PPE. There's also a few other things like a contagion report based off of access control and also real-time location services. So, Brian, we when you last visited the healthcare institution, you didn't have COVID, but you've developed symptoms, and after getting tested, you now have COVID, and you've given the healthcare institution a call saying, just want to let you know that I've acquired COVID, and I want to make sure that anything that I might have touched, any persons that I might have been in contact with, it's probably good to give them a call. And so to facilitate that contagion or that contact tracing, we could see based off of your real-time location services who you've been in close proximity to, and then we can give them a call just to let them know that they were in contact with someone that has COVID. Same as doors. Every door that you've contacted, show me every single door, or show me anyone who's been in proximity to that door within a certain time frame. And so that ultimately, it's something that's built in any access control report, but access control vendors haven't really thought of that use case up until the pandemic hit. And so as a result, we've made some customization in our reports to make it simpler for you to just plug in the individual with COVID and identify, okay, who are the individuals that might be in contact or might have touched that door handle after you've touched that door handle. And so that was a request that came directly from a field hospital in the U.S. That we've made available free of charge for other customers. And lastly, we've seen a lot of cases of standard operating procedures being used in the healthcare, variety of different healthcare environments. So whether it is a mobile guard or it is someone that is making the checks to verify that any persons with COVID does not enter a part of the hospital that is not designated for COVID patients, there's a lot of evolving policies that change sometimes by the day, sometimes by the hour. And it can be challenging to roll out these new operating procedures, what questions to ask, how to respond based off of those questions. And so that's where we're seeing an adoption of the standard operating procedures that are programmed within the security system that can be installed at that remote areas for people to be guided through these standard operating procedures. I have a new patient that's arrived. Here's my first question. After I ask that question, do they respond yes or no? If yes, then go towards this, ask this question. If yes or no, go through that question. So there's that simplification of codifying all of these standard operating procedures that are dynamic in nature. So that ultimately ensures that operators or any users are following protocol based on what's been codified in the system, as opposed to just training and saying, here's sort of your user guide. This is your incident response guide. Read it and really memorize it. By the way, that might change in a few days.
No, fair enough. And the one thing there that I kind of wanted to reiterate that you alluded to was Genatech working with their industry partners to develop solutions. And just from my experience with Genatech and different facilities I've worked in, I can say that's definitely the case. So it's a great thing for an end user to have a service provider who's willing to work with them and develop solutions like that. Now, you detailed many different things, different practices that Genatech has initiated during this crisis. And in light of the end user feedback, which of these technologies do you think are going to be more commonplace post-COVID?
Yeah, that's a great question, Brian, because there and we've also seen that reservation as well. Like, is this a purchase that we're going to make, or is this we're going to go through the process of introducing maybe new technology, and is there going to be that lifespan post-COVID? And so I can comment based off of what I've seen, or the reservations that I've seen, or the absence of reservations that I've seen within the healthcare sector. I think that the PPE inventory management system would have a life after COVID. It might be for all other low value equipment that traditionally never was tracked. That does contribute to overall shrinkage within a healthcare environment. But now that COVID might have been a trigger to invest in a makeshift PPE inventory management system by installing a reader on a door. That traditionally used to be mechanical brass key, and so we never had tracking on that door to the inventory, the inventory room. Now that there's a camera that had already been installed, but you've already upgraded the door from a mechanical brass key to an actual online access control lock, then hey, why not? Let's continue using that for PPE or for other low value equipment. So I think that still has a shelf life after the fact. It's been, purchased or pursued to tackle COVID, but likely has a life after. I think patient-nurse communication opens up the possibility of potentially centralizing communications. Traditionally, nurses would interact with their patients physically, but I think that after building out the infrastructure, or at least figuring out the mechanics of how can nurses actually interact with their patients digitally, opens up the possibility of maybe working with a skeleton staff. Maybe that be one day centralized, where you can have a nurse that's checking up on a patient that maybe isn't even in that location, maybe is at a different healthcare institution, maybe is out of the country, just to ask those routine questions. And if they recognize that there's something that needs physical contact, and then they would dispatch that to a closer individual. But at least by seeing that digitization in the healthcare industry, that's been brought on by COVID, I think that opens up the opportunity to actually rethink the way that nurses interact with their patients. And that can have actually quite massive benefits to helping mitigate or bring down employee burnout that we see often within the healthcare sector. Too many hours, from nurse and staff that eventually, through centralization, through technology, we could try to contribute towards reducing. And I think that there's always an application for SOPs in anything that requires a combination of people and processes. And so all we're doing there is adding that technology layer to the people and process. We have humans that interact with each other, and they have specific processes. Let's use technology to ensure that they're following those protocols as they were initially codified in the system. And there's all kinds of applications beyond COVID. It could be, an employee check of making sure that the clean room has been properly cleaned according to compliance, and verify. It's like, instead of a paper checklist, it could be a digitized checklist that's all codified within the security department. So you're seeing that security is making this shift towards or shift away from simply just protecting people and assets, actually helping other departments figure out more operationally efficient ways to do their job.
Now, a bit of a loaded question for you, but what can we expect to see from Genatech in the future?
Well, Brian, we're definitely focused on building solutions that help guide operations and the workforce. I think that you could definitely stay in tune with tools that are a lot more operationally centric, because we're seeing that shift in the end user community of security teams that want to make a bigger impact in the organizations that they serve. And we think that operations is definitely the way of the future. I think greater analytical tools to help ultimately enforce policies and guide decisions. So there's a warehouse of data that healthcare institutions are sitting on, and that number is growing more and more. And I think that brings out the need to ingest that data when it's needed, and that shouldn't require analysts that have to parse through loads and loads of data in order to arrive at a decision. I think that information needs to be actionable. So we'll likely see a lot more of that type of those analytical tools to be used for specific personas, whether it's planning, design, and construction teams to actually build the future hospital or reorient real estate, parking, and things like that. But I think that the future goes beyond security, especially in the healthcare. Security continues to shift their mindset away from reacting to potential threats, to protecting people and assets, to really contributing towards or partnering with other departments in order to protect the patient experience. I think that that's the future. That's the vision that we're seeing a lot of healthcare institutions adopt. And as a result, the security platform is that foundation that could be used to share digital evidence, that could be used to collaborate with real estate departments, collaborate with safety, collaborate with operations, with nurses. The security system shouldn't just be used to lock and unlock doors or to verify individuals coming in or to grant visitors access to certain areas. It should also help the different should help nurses communicate with their patient. It should help other departments be more efficient at their job.
All that being said, we covered a number of topics today. Is there anything that I haven't asked you about yet that you maybe wanted to take some time to discuss now?
Well, there's all kinds of things that we can talk about, but I think that cybersecurity is probably top of mind for many healthcare institutions. I think that the future is definitely converging physical security and cybersecurity together, especially, whether it's in response to COVID, because there have been an increase in malicious behavior on the World Wide Web. There's, of course, the numerous amount of ransomware attacks that particularly hit the healthcare industry a few years ago. And of course, healthcare is one of those targeted industries for cyber attacks. So I think that there's going to have to be a shift in talent, where the future security practice is going to be IT security or logical security, a converged group with physical security. So there's going to be sort of a convergence in talent. And that would have to affect people. It would affect, again, process, to ensure that processes are both considering the logical threats and the physical threats, and also technology. The technology that could help enable those teams or enable that conversion. Like, for example, I read recently that Health schools are starting to train the physicians of tomorrow to, how to respond if, say, there's a ransomware attack and you lose access to your scanning systems, or you lose access to any vital systems that you'd need in order to actually provide a diagnosis. So without those tools, you have to do it the old way. Go. And they have to figure out, well, how do I do this after we've been hit by a ransomware attack? So that's particularly interesting that we're starting to see that behavior, or at least that preparedness and readiness. And so I think that's definitely the future. It's something that we've already saw, but of course that there's that conversion that still needs to happen within physical security.
Great. Now, in closing, what message would you like to share with the Healthcare Security Cast community?
Well, I think that it's important. I know that it's very hectic time right now, but it's important to take a step back and ask yourself, what is the vision that I want for my security team? Whether you're, the supervisor leading that team, or you're the or an active operator, I think it's always important to take a step back and ask yourself, is the way that I'm doing things the best approach? Is there a better approach? So, how do you envision your security practice evolving within, say, 5 years? And then maybe work with colleagues to bounce some ideas. How have other healthcare institutions evolved their security practice? How have they been partnering with other departments in order to get those brownie points and ultimately prove to leadership that security is not just about preventing the flow or by creating friction in order to keep people safe, but security can also be there to enable the flow, to help other departments do their job a lot more effectively. So I think that's an important question. And then once you've adopted, or once you've set that vision, you've got that buy-in with leadership, then my recommendation is to inch towards that vision. So on one end, work with other healthcare institutions, learn from what milestones that they've created, or ask them what their vision is in order to get ideas in terms of evolving the security practice, and then slowly start inching your way towards that security vision. It doesn't have to be a brute force replacement and overhaul of security policies or staff. It could be slow increments towards that vision that ultimately will serve to protect the patient experience.
Excellent. And for anybody who wants to know more, what's the best way to connect with you, or to reach out to somebody at Genatech?
Yeah, so you could reach out to anyone at Genatech. We're a team of extraordinarily motivated individuals. So if you reach out, whether it's through social media, whether it's by email or phone, you'll likely get someone that may not have an answer to your question, but will find the best person to respond to you. We're also on social media, so feel free to connect. Genatech has a presence on LinkedIn, Twitter, Instagram, and Facebook, so you could interact with the people that are managing those respective tools. They're actually being managed by close colleagues of mine. There's always that human presence behind those pages. I also encourage anyone to reach out to me on LinkedIn, or reach out to their respective Genatech sales manager. And maybe a point I'll add to there is that it doesn't have to be through sales. Your gateway doesn't have to be by contacting sales. If you want to have a conversation around R&D, sales can probably help bridge the gap and connect you with the right person in R&D. Or if it's someone within another department, support, customer service. Anyone at Genatech loves getting their energy from the end user community. So I encourage, if you are an end user, there's definitely someone at Genatech that'd love to talk to you.
Excellent. Well, thank you for that, Derek, and thank you for taking the time. There's a lot of valuable information in there, so I appreciate you taking the time today.
Yeah, well, Brian, thanks for having me on today.
And this concludes another episode of the Healthcare Security Cast. Thanks for joining us. I want to say a special thank you to our sponsor, Genatech, for making this all possible. And thank you for listening. Until next time, stay safe and take care.